Good evening, everyone. On behalf of NYU Meyers College of Nursing, I would like to welcome you to tonight's Myers Marvels event. NYU Rory Meyers College of Nursing is committed to producing lifelong learners who will excel in their nursing careers and be recognized as leaders who keep patient-centered care and the health of society at the forefront of their values. Meyers graduates hold positions of leadership in the profession, practicing in diverse clinical, academic, and administrative settings. The Myers Marvel series shines a light on some of our most prominent alumni that have influenced the nursing profession. Tonight, we are thrilled to speak with Jessica Brumley. Dr. Brumley is a certified nurse midwife, researcher, educator, and leader in the field of maternal health. She has been a local, regional, and national leader in the American College of Nurse-Midwives and is the current president. She has practiced clinically for over 20 years and is the director of the Division of Midwifery at the University of South Florida. She is an associate professor and vice chair of health equity in the Department of Obstetrics and Gynecology. And Dr. Brumley is passionate about improving health equity for women and reducing racial and ethnic disparities in pregnancy outcome. Tonight's program will be moderated by Dr. Sasha James Contarelli, who is the director of the Nurse Midwifery Program and clinical associate professor at NYU Rory Meyers College of Nursing. I will now turn the program over to Dr. James Contarelli.
Hi, good afternoon, everyone. Well, evening, everyone. And thank you for joining us. Thank you so much, Janet, for the introduction. And I'm so excited to have this conversation and some time to talk with Dr. Brumley, and who I know really well. And so it's an honor for me to have conversation with her regarding some topics near and dear to her heart. So Dr. Brumley, to start this topic and this conversation off, can you share a brief state of the union of midwifery for the audience, the midwifery profession? Oh, you're still on mute. Oh, it's okay.
Of course, I was still on mute. It's not a Zoom call if if we don't say that, right?
Right.
Oh, that was just to get my nerves out. I don't know why I always still get nervous for these things. I just wanted to start by saying thank you. Thank you for inviting me. I hated that I couldn't come to the midwifery anniversary event, and so I was really thankful that I had this opportunity to talk with you this evening. It's really great to be here and talking about what is my favorite thing to talk about, right? Midwifery, particularly midwifery in the U.S. right now. There are almost 17,000 midwives practicing across the United States, of about 14,000 certified nurse midwives and certified midwives, and a couple thousand certified professional midwives. Together, we're attending about 1 in 10 births in this country, and this is real growth. It means more families are finding their way to midwifery care, and this is care that centers respect, safety, and evidence. And we know the impact that midwifery care has. We see it every day: better outcomes, healthier families, but also births that honor the person giving birth, and this is really something powerful. But we also know the challenges. Access to midwifery care still depends too much on where you live. Some states have strong networks and supportive regulations, and others make it nearly impossible to practice to our full scope. And in some areas, there's just one midwife for every 1,000 births. There are too many communities that are still existing as maternity care deserts. We all know the difference that even a single midwife can make in these communities, or a midwife nurse team, and the impact that can make in those spaces. We also feel the pressure within our workforce, right? Burnout is real, and so is the frustration of knowing how much good we can do when the system is really getting in the way. But there is good news, right? People are listening. Policymakers, hospitals, and even private foundations are starting to recognize that midwives are part of the solution. It makes this a really exciting time, especially when it comes to addressing issues of health disparities. We really have a huge opportunity, And if we can expand education and modernize regulation, build midwifery-led collaborative models, we can really revolutionize what maternity care looks like in this country. So I really think that we're at a pivotal moment, and it's our opportunity to lead and teach and advocate and make sure midwives and nurses are at the center of every conversation that is being had around maternal and also sexual and reproductive health in this country.
Thank you so much.
Mhm.
And you started to talk about my next question, and it leads right into it of, given the ongoing maternal health crisis and issues in health equity, what role can midwifery-led care play in reducing racial and socioeconomic disparities in birth outcomes?
Yeah, absolutely. We know that the United States continues to face a maternal health crisis marked by deep racial and socioeconomic disparities. Black women are nearly 3 times more likely to die from pregnancy-related causes than white women, and poor outcomes are concentrated in communities with the fewest resources. And I must say, we have a system that is designed to create these outcomes, right? I mean, that's you get what you pay for. You get what you put into a system, and this is what it was designed to create. But we know that midwifery-led care offers a clear evidence-based path to reducing these inequities, and midwives are out there revolutionizing systems of care. Midwifery-led models prioritize time, trust, and continuity, and the foundation of equity in care are these components. We typically spend longer with our patients, and the relationships that we build where people feel seen and heard and respected, that makes a difference. We're out there building joy instead of fear, right? We're not looking for the problems, right? We're uplifting the strength. This relationship-centered approach improves patient engagement, it reduces stress, it supports shared decision-making, and these are all factors that improve outcomes for racialized and marginalized people. We're also promoting physiologic birth, and by doing that, reducing unnecessary interventions. We have a really high rate of unnecessary interventions in this country. There was a big New York Times article just this past week about the use of continuous electronic fetal monitoring and how it's just leading to increasing cesarean sections. But right, midwifery-led care focuses on normal physiology and understands that strategies like intermittent auscultation, can be used effectively to care for people safely in labor and improve outcomes. And so we need to really lean into this model of care. Midwives are also expanding access in underserved communities. We're the frontline providers in maternity care deserts and rural areas, and attending community births, and expanding midwifery education, reimbursement, and full practice authority can help to distribute our resources more equitably and to bring skilled care closer to those who need it. But I would be remiss if I didn't talk about the importance of diversifying the workforce and the role that plays in health equity. When the midwifery workforce reflects the communities it serves, outcomes improve. Investing in pathways for midwives of color and those from underserved backgrounds helps to rebuild trust in health systems and provides culturally attuned care that addresses bias and discrimination. The ACNM Midwifery Education and Equity Study identified barriers to growing a more diverse workforce, including reports of discrimination in classrooms and clinical sites, a lack of racially concordant mentors, and persistent inequities in educational environments. We know what this means. To grow our workforce, we must expand education, remove barriers, and build equity into every step of the pipeline. NYU has taken this very seriously and has what I believe is the most diverse midwifery education program faculty in the United States. Correct me if I'm wrong, Sasha.
No, you're absolutely correct. I could say
Yeah.
that as being a director of midwifery education in the United States, and even though you're president of our organization, I'm privy to being with that group. And so you're
Mhm.
absolutely correct.
Yeah. And this is really important. I mean, especially considering that our recent cohorts of midwives are the most racially diverse in our history. And so we're seeing a new generation of midwives, right, coming into the profession. We have to meet them with the support, equity, and opportunity that can really transform our workforce into one that truly reflects the communities we serve. I think that's really critical. And I think that it's important to note that
Mhm.
integrating midwifery into this, it is a system approach, right, to changing the system. It's not just about the individual provider, right, but the midwifery model of care and the integration of midwifery is really a systematic approach. And that's what we need to do, right? We sometimes I feel like we need to burn it all up, right? Just like start from scratch. But to a certain extent, that's what a lot of midwives are out there doing. They are creating grassroots models of care that are really revolutionizing how care is provided in their community.
All right. You're absolutely right. From your standpoint as a national leader and international leader, what are some of the strategies that you're aware of that are being pursued to support midwifery workforce? Because we talk about that, right? And you just
Mm.
mentioned our workforce and our numbers. What's your knowledge of some strategies?
Well, I think that there are a couple different approaches. And one is the advocacy and the policy work that we're doing at ACNM. ACNM created state policy fact sheets to help support state level advocacy work. And this work is focused on addressing state level policies that can encourage the growth of the midwifery workforce, such as requiring physician supervision for licensure, prescriptive authority, full reimbursement, or even hospital admitting privileges. And we know that any restriction on midwife independence links midwifery practice with physician practice. And so it creates an environment where the supply of midwives is dependent on physician demand for midwife employees instead of consumer demand for midwife services. So states that adopt early independent practice have seen a significantly greater growth in their midwifery workforce. So that's some of the policy work that we've been doing at the state level. At the national level, ACNM has helped to lobby to secure over $44 million in funding for midwifery education. That's what helps us to, right, grow more midwives, midwife scholarships, the MAT care programs that have funded over 10 midwifery education programs and the work that they're doing. So there's that federal policy work that we've been advocating for. And we can see that the numbers of midwifery education programs are growing. And this is after years and years of stagnant, right? Almost no new programs. We're seeing new programs, and we're seeing programs in diverse settings now, right? I mean, we've always existed in schools of nursing, but now we're existing in health science centers and academic medical centers and schools of public health. And so there's really been I think like a 23% growth in midwifery education programs in the last 10 years is what I calculated. So really expanding midwifery education programs is critical. But we also see that a lot of people are just they're just kind of skipping through nursing into midwifery, right? So, I went through my 4 years of my bachelor's program, and then the very next year I was at the NYU Midwifery Education program, right? I mean, I went right through and I worked a little bit part-time. So I'm part of that cohort of people who just go straight through nursing into midwifery. And there are a good number of individuals. About a quarter of new grads would say they would have become a certified midwife if they were licensed in all 50 states. And so that, New York has been a forerunner in the certified midwife credential, but we have been very stagnant for many years in the number of states that have licensed certified midwives. And so we've really been pushing that as an opportunity for us to grow the midwifery workforce, because it's a direct pathway, and it frees up, right, nursing's education seats for people who want to pursue nursing directly, right? Many states have limited numbers of nursing education slots. So those are some of the advocacy components, but I think it's really important for us to also recognize the burnout that's happening in our profession. And a couple years ago, there was a survey of practicing midwives in the U.S., and they found one of the greatest predictors of midwife burnout was organizational factors, such as their practice climate, such as practice leadership and participation and support of the midwifery model of care, which happens when you have a strong midwife leader. And so those midwives that were practicing in environments with strong midwife leaders had lower rates of emotional exhaustion. That piece of data, that's really helped to support me when I'm having the really hard days as a midwife practice director, and help me to push through many leadership challenges, right? The work that I do matters to all the people on my team. I'm helping to create an environment where they can thrive. And so as an organization, we have to think about what can we do to help develop midwife leaders so that there are midwife leaders to support, right, practicing midwives. And so we have a committee, a leadership development committee, and they've been working on a leadership development framework that can help to inform our leadership development activities and workshops and different events, mentorship opportunities to really help to build leaders in our profession. And I believe that's really critical. And I think that also leads to the next thing that's really important is building community. And I ACNM has been my professional home since I became a midwife, since I was a baby midwifery student. And I believe strongly that our professional organization can and should fill the role of being, right, the professional home for midwives. And ACNM provides this structure for midwives to be connected to community, both at the local level and at the national level. And that community can take many forms, and it offers resources of connection and knowledge and expertise, leadership and support in a healthcare system where midwives are often practicing alone, or maybe just with a few other midwives, maybe along, physicians within this kind of larger medical industrial complex. ACNM helps to bring midwives together, giving them a collective voice and supporting the individual midwife to advocate for the values and standards and full scope of midwifery practice. So through our affiliate structure, ACNM makes itself relevant to local communities of midwives and meets the specific needs in a region. Affiliates in many states also support chapters that serve as a base of support in a particular city or region. And affiliates can help move legislation forward. That state policy work that I mentioned earlier, that can only happen at the states. And so affiliates are what really help to make that, help to move that forward. But we also create professional development opportunities, and we collaborate with midwifery education programs in the region. This is where we find our preceptors often, or help to, problem solve. And we serve as a place for midwives to just get together. Like our recent meeting in Palm Springs, like that filled my cup, right? Like those are the kind, and I heard that message over and over again. This is sort of the inspiration. And when we get together, we can, we support each other. And so, just creating a stronger, more vibrant professional organization will help the individual midwife to be able to sustain in their career for longer as well. That was a lot.
Yeah. There's quite a few things that you touch on, because all of these things that we talk about over and over again within our own midwifery community, that I'm glad we're able to share here in this space, the issues with workforce and education and pathways to education, and even the different types of midwives, and not saying types, but for lack of different,
Credentials.
there are different credentials, and CNM and CM and CPM, and we have multiple conversations, but I want you to go a little bit more in depth about like innovative models.
Mm.
And you mentioned grassroots midwives at grassroots level being
Yeah.
innovative in practice. What are some of the innovative models that you are aware of that are being developed to address a lot of the issues that we continuously talk about? Because midwives are not the only ones with burnout. That's a pervasive issue in healthcare. But what are some of the things that you know about specifically?
When, you know, when midwives feel like they can truly practice midwifery care, right, then they thrive, right? They're happier when they're practicing the way that they were trained and what was intended. And there are midwives out there creating models that are just right, truly brilliant.
Yeah.
And early on in my career, I had the opportunity to start a group prenatal care program at my institution. And group prenatal care was originated and designed by midwives. It was this opportunity for me to develop true connection with people that I was caring for at a deeper level, having those longer chunks of time, which I don't normally get in this like academic medical center model with 15-minute prenatal appointments, but to sit in a room with people for 2 hours and what they shared so intimately, right? That was beautiful. But now you see them. I feel like you see people taking it to the next level. You've got Carrie Stewart, who's running melanated midwifery, where you have racially and culturally congruent midwifery and doula care in the community in group prenatal care model. And so it's these like layers of evidence-based interventions that I can only imagine will be exponentially better for the people that they're caring for. And they currently have a PCORI grant that they're using to evaluate that model. My own practice at the University of South Florida is a practice that's existed for 40 years, and we've slowly developed this program to be completely integrated into the Department of OBGYN and the College of Medicine, where you have midwives teaching OBGYN residents on normal physiologic care alongside their midwifery students and other learners. And so they're learning their interprofessional education, collaborative care. They're learning about each other's scopes of practice. And we also serve as the primary referral hospital for midwives attending births in the community. And so they're also learning about community-based birth and what respectful care can look like when people transfer from a midwife in the community to a midwife in the hospital, and the needs of those patients. We've got the midwifery group that's helped to be led by your very own Dr. Alexis Dunn, right, at Choices in Memphis, a birth center focused on Black women in Memphis, prioritizing women on Medicaid, housed within what was an abortion clinic only before, right? And that is now what I think of as true full scope reproductive health care. You can go in there for all of your needs, except of course now legislatively Tennessee has a near abortion ban, but they innovated again, and when they expected that was going to happen, found a location as close as they could in Southern Illinois to continue to provide termination of pregnancy services as needed for their clients. And so that's another, I think, great example of innovation. Black midwives attending care for predominantly Black women in a community-based birth setting, right? The layers again of the evidence-based interventions that are being provided there, and just a really beautiful space. And then we've got Community of Hope in
Mhm.
DC, right? Led by, Ebony Marcel, that is a birth center housed within a federally qualified community health center, a beautiful birth center. These midwives attend births in the hospital and at the birth center. They've got space for group prenatal care there. They've got all the full wraparound services that you get by being part of a federally qualified community health center. So really supporting all the needs of of their patients, and then also recently had received grant funding to provide home postpartum services as well, right? Like that's a dream for me as a midwife. I would do just that job. Home postpartum services. And
Right.
they're going out there and they're sharing their their work and sharing these models, and this is, I think, inspiration for people in their communities to say, look at what these people are accomplishing in their communities. How can we find something different for our community and improve the care in our community as well?
So I want to pivot a little bit
Mhm.
because you alluded to this, but I don't think the audience knows about your own practice and your unique position because, to my knowledge, you're the only midwife I know of in the country that sits in this specific position. And we chatted a little bit about it at our annual meeting. I know you probably remember, but I think I want the audience to understand what your position is, and then we'll go from there.
Sure. Yeah. I mean, our practice is within the College of Medicine in the Department of OBGYN. The department has a department chair. I've been on faculty there for nearly 20 years, and I've been the division director for over a decade. And just as any academic, individual, right, can be promoted, among assistant professor, associate professor, professor, and but then also as far as leadership within the department, you can be a division director, a vice chair of almost anything. There's a lot of variety in the appointments of vice chairs and then chair of the entire department. And I don't know of any midwife that's a chair of a department of OBGYN of physicians. And I guess I don't know of any that's a vice chair. I would love to meet others because I'm sure that's a small community, and we could give each other support. A lot of the work that I have done outside of my clinical practice has been in advocating for health equity and birth equity in our local area and our state and our nation as well. And I helped to serve as the state co-chair for our birth equity initiative in Florida
Mhm.
and the State Perinatal Quality Collaborative. I think it was just all of this kind of level of engagement and work in that area that led my chair to appoint me as vice chair of health equity for our department. And it's a very fluid kind of role. And so that's been really nice because I've been able to do with it what I can while also being president of ACNM and running the division of midwifery. But I think mostly it gives me just a little bit of a stronger voice in the department and at the university and in the state. So it's really an honor to be able to have that role.
Now, none of us get to where we are in life by ourselves. And
Mhm.
so mentorship is quite important, right?
Mhm.
And so tell us a little bit about your journey and mentorship and what that has meant to you and your progress to where you are today.
Whew. I mean, we stand on the shoulders of those who have come before us, right? And I ended up at NYU in a big part because when I was in the sixth grade, I attended my mother's graduation from NYU right there in Washington Square Park. She's like my ultimate, mentor, and um, really my rock, you know. I really honor that memory. And I have had so many powerful mentors throughout my professional career. When I was an undergraduate at USF here in Tampa, I was part of the McNair Scholars Program, a program designed for underrepresented minorities to pursue doctoral education. And they assigned us mentors. And it started with a uh, a mentor who you could relate to ethnically, racially, right? Not in necessarily in your major, your profession, someone who looked like you, someone who came from the same neighborhood, something like that, right? And so I had this wonderful Puerto Rican oncology researcher who just like took me out for food and we would just hang out and connect. And it was just beautiful to see somebody who looked like me doing that kind of work, who had PhD after her name, right?
Mhm.
And then I was assigned a mentor within the College of Nursing, right? Who was really just to kind of get me connected to nursing people. And then I was assigned, happened to also be a nurse, but a research mentor, someone to help me conduct research and really go through that process. And I have continued to have people who have served each of those roles throughout my career. It's just like a beautiful thing. Cecilia Jevitt was the practice director when I was first hired here over 20 years ago. She hired me, and she was on faculty at the College of Nursing. So she was also my dissertation committee chair and mentored me through my early clinical practice and my PhD role, and really has given me so much advice on service within the professional organization as well. And then I was connected to a research mentor through the Johnson & Johnson Maternal Child Health Leadership Institute. I was connected to Dr. Diane Spatz, who's at Penn and is an internationally renowned human milk and lactation scientist. And she's just amazing because she keeps pulling me into things. And this is how I get publications. He's like, come with me and let's do this together. And I have a sabbatical. Can I come visit you? And we find ways and we continue to work together. And it's been beautiful. And then, within the Midwife of Color Committee, now council at ACNM, that's where I actually started some of my first national level leadership was within that group. And the chair at that time was Maria Valentin Welch. And, one of the few Latina midwives that I saw in leadership at ACNM. And she was the one who mentored me through becoming a fellow and being inducted as a fellow of ACNM. And those are just a few examples of people who have mentored me. I absolutely have always wanted to give it back. And so I have served as a Midwife of Color Committee mentor. I served, had many mentees through many years. And we were always very intentional about bringing people along with us on our leadership journey. And when I became chair of the Core Competencies Revision Task Force, I invited who was then a student midwife, Mari Carmen Farmer, right? And then and then I said, hey, you need to chair it, next time. And then I was like, don't you want to serve on the board with me? I need another friend. And there she is serving on the board with me now, right? And so it's really just I guess I just am appreciative of the support that I have received and recognize that, I need to give it back too. And also I get so much, right, from the relationships that I've been able to nurture and form through the years and as a mentor. So it's just critical. It's critical to sustainability, like to prevent burnout and also to inspire greatness in each other. Yeah.
So I said that to you, and I'll say it again publicly. Dr. Brumley, to those who don't know, has always been a wonderful inspiration to me, and so I thank you very much for all your work and leading by example with those things that you have done. Mari Carmen, yes, has come so far. And so now I'd just like to end, before we open it up, to what
Mm.
advice would you have? There's many students on this call. There's
Mhm.
all new grads that I see on the call. What advice would you have to nursing students, new grad midwives that are coming up?
Oh, I get a few words of maybe inspiration. I would say that you are not just stepping into a profession. This is really a movement. And you're part of something that is so big and a legacy, I would say, that stretches back generations, one that's still being written. And your presence and your voice and your leadership are needed right now. It's not too soon to become a leader, right? You do have a very strong and important voice, and and the work is hard, right? The work will require courage and it will require collaboration, but it will also offer profound purpose and joy and connection. You are not alone. Your professional organizations are here to support your growth and amplify your voice and stand beside you in this fight for equity and dignity and access to nursing and midwifery care for everyone. So I encourage you to dream boldly, speak confidently, and know that you do belong here. This is your profession.
So I want to thank you so much for being here with us tonight and sharing your words of wisdom. I'm going to turn it back over to our leader, Janet Griffin, to close out the evening for us.
Thank you so much, Sasha.
Thank you.
Yeah, thank you so much, both of you, for this great discussion tonight. We have a couple minutes left and just want to see if anybody has any follow-up questions for Dr. Brumley. Now is the time. We had a lot of great discussion tonight. So if anything else is burning on your heart, now is the time to put it in the chat, or even just go off mute and ask your question that way. Anyone? I actually have a question for you, Dr. Brumley. So, because so much was discussed tonight, but this is a question I like to ask a lot of people when we do these events. If you had unlimited resources to solve just one problem facing the profession today, what would that problem be, and how would you go about solving it?
Just one?
I know it's hard to pick one, right?
There are so many. I well, I mean, we've talked about so many of the issues. I would just want to make us so mainstream, just so normal, right? That that in other countries, everyone says, I'm going to see my midwife, and it's the norm. And so I would do everything that I would want to do to mainstream midwifery. And that would definitely be a big old multi-pronged approach, right? I mean, you'd have to market midwifery, you'd have to grow midwives so that there are midwives in every community, so that people can just go and call their midwife and go on in, and midwives would be practicing in all the different practice settings, and they would be fully integrated into the system, and there would be respectful collegial communication, and right, because that's how you mainstream midwifery. It has to be fully integrated. It's the norm. And that's what I would want. I would want to mainstream midwifery.
That's a good answer. All righty then. Well, that will be our last question, looks like, for the evening. Again, Dr. Brumley, Dr. Sasha James Contarelli, thank you so much for putting this program together tonight and being here with us. And to everyone else who was with us this evening, appreciate you being here. You'll be getting a survey later on in your email box this evening. Would love to get your feedback about this program. We always love to create wonderful programming for all of our alumni and our friends. So hopefully you'll come back. So again, everyone have a wonderful night, and we will see you again soon online or in person.
Thank you,
so much
everyone.
for having
Have a
me.
Good evening.